Respiratory Syncytial virus, better known as RSV, a health promotion presentation for pediatrics by April Knapp, student nurse. What is RSV? Respiratory syncytial virus, better known as RSV, is an acute respiratory infection which can result in serious illness. It can present with the same signs and symptoms as the common cold or flu, and it causes a lot of lung problems in infants and children, including bronchiolitis. Most children who get RSV get the virus by age 2, but people can be infected at any age and more than once in their lifetime. Most individuals recover from RSV in a week or two, but some people at high risk may become very sick and develop pneumonia or bronchiolitis, which is inflammation of the small airways in the lungs. What are the risk factors for RSV? Risk factors for RSV include being a child younger than 2 years of age, premature birth, heart disease or other chronic illness, frequenting crowded places, having a weakened immune system, poor hand washing skills, environmental air pollutants, living at an altitude higher than 8,202 feet, asthma, Down syndrome, and cystic fibrosis. How is RSV diagnosed? Diagnostics and laboratory testing to confirm diagnosis of RSV. Lab test. Rapid antigen detection test identifies RSV. RSV antibodies may be elevated. ABG may reveal hypoxemia and respiratory acidosis. CBC with differential may show a normal or mildly elevated white blood cell count with increased bands. Imaging. Chest X-ray may show hyperinflation, parabronchial thickening, atelectasis, interstitial infiltrates, and segmental or lobar consolidation with pneumonia. Fluorescent antibody testing determines presence of RSV and nasopharyngeal secretions. So what are the signs and symptoms of RSV? Nasal congestion, coughing, wheezing, malaise, fever, myalgia, earache, dyspnea, sore throat, vomiting, apnea, and cyanosis. These cartoon images depict some of the symptoms of RSV as well as ways to prevent the virus. As nurses, what can we do for our patients who have RSV? Some of the nursing interventions we can do for our patients with RSV are to adhere to standard precautions, implement contact and droplet precautions for the duration of the illness, assist with coughing and diaphragmatic breathing exercises, perform chest physiotherapy and suction when necessary, administer prescribed oxygen as needed, auscultate lung sounds for any changes, place the patient in the semi-Fowler position to maximize chest expansion and ease work of breathing, observe for signs and symptoms of dehydration, provide frequent small feedings to reduce oxygen demand, and promote rest. Some more nursing interventions to discuss. We should offer diversional activities as appropriate for the child, promote adherence to isolation precautions and strict hand hygiene for all visitors, and monitor the patient's vital signs, especially the O2 level, nutritional status, fluid balances, and signs and symptoms of infection or respiratory distress or failure. So now that we know what RSV is, how can we treat it? Some treatments for RSV include antiviral ribavirin, which is specific to RSV. It's a treatment of severe lower or respiratory tract infections with RSV, and it's usually reserved for ventilated children. Ribavirin inhalation therapy for patients with immunosuppression and severe infection. It may be combined with immunotherapy with select patients. Bronchodilators such as albuterol sulfate via nebulizer or inhaler, or racemic epinephrine hydrochloride. Corticosteroids can be used if there's a lower airway obstruction, oxygen therapy for severe infection, IV fluids, and monoclonal antibodies, which are used to prevent serious lower respiratory RSV disease in certain high-risk groups of children. Health promotion and maintenance. While there's no vaccine for RSV at this time, here are some ways we can prevent it. Teach your child to wash hands often with soap and water for at least 20 seconds, especially after coughing or sneezing. Alcohol-based hand sanitizers will work to kill germs. Teach your child to sing the happy birthday song or the ABCs while washing their hands. If your child's sick, teach them to cover their mouth and nose with tissue when they cough or sneeze. Your child can also cough into the elbow. Throw away tissues in the trash and wash hands after touching used tissues. Do not get too close to or share food and drink with those who are sick. More ways to prevent RSV are to wash the children's toys daily. Avoid crowded places. Do not allow anyone to smoke around your baby or your child. Children who are born premature or have some diseases are more likely to get RSV. There are shots such as Syncytial, which infants can take each month during RSV season to help prevent RSV. Ask the doctor if these shots are right for your child. RSV is alarmingly the #1 cause of hospitalization in infants under 12 months. Do your part. Protect your babies. If you would like to learn more about RSV, you can check out the references listed below.